Right. This is a quick video for the guys at Healing Wave. Hello, folks. How are you doing? Now, I know you've got 460s. We've only got 440s here we're going to demonstrate, but we're going to show you how to use them properly, and I mean properly, so you don't break them and you get years and years and years of service out of these tables. I've seen the way some people utilize these tables, and it's not ideal, and that will lead to them breaking ahead of time. And it's also not the best way to adjust your patients. And some of you might know that I'm a Thompson technique instructor, and getting this stuff absolutely right is pretty important to me. So anyway, we'll come along and I'll show you a little bit about how we're going to use this table. Now, first thing is, you know how to lower the table. We hit the foot switch and we lower it down. Okay, that's the easy stuff. But what we really need to do is make sure that when we're setting the table up, we're setting it up at the right height for our patient, and we're also not using the drops as though, using the table as though it's an anvil. We're utilizing the drops to amplify our speed and amplify how effective our adjustments are. So first things we'll do, well, I'm going to get a patient up through here. So here's our colleague Tori. Tori's going to load up on the table. Now, first thing we want to do is make sure that we've got a 2-finger gap between these two sections. The reason we've got a 2-finger gap is because if we have got a directional drop option on our pelvic section, and if we've got a drop that hasn't got enough space to move into, these two cushions are going to bang on each other. That's not going to be great for either the drop mechanism or the cushions. So they're going to wear out ahead of time, if not get torn and ripped in that area there. The second reason we do that is it gives us a bit of a guide for the ASIS as we line the ASIS up roughly with the gap in through here. And depending on the height of the patient, we can just move each of the sections up and down. If you've got a power front section, you'll find that that's about the minimum gap that the power front section will allow you to have with that particular setting. Anyway, so with our patient set up, and if we've got a split dorsal section on a slightly shorter patient, get another piece of tissue. Make sure that all of your cushions are covered, particularly with women, because they tend to wear foundation makeup, and once it gets onto the leather, you can get it off, but scrubbing it makes a heck of a mess, and it also wears out the protective coating on the leather, and so it's going to expire ahead of time as well. So the tip there, use a secondary piece of tissue paper that sits just below their chin so they're not getting foundation on the table. So again, kick the table to reset it, and we're lowering it down. Good habit to get into is hand on the patient's back. That gives them some assurance that they're not going to fall backwards. And it also means that you've got control over them and they're not going to step off the table again if they get a little bit alarmed. We have got an adjustable height ankle rest. You can set that so that it stays at this height when the patient's in the prone position, or you can set it like we typically do at about 1 notch or even 2 notches up. The adjustable height ankle rest goes a long way to reducing the tension into the hamstrings. And if somebody's got a hyperlordosis and a lot of back pain across the belt line here, raising the ankle rest up makes a big difference. It also lifts the feet up a little bit more, so it's a little bit more accessible for when we're doing our leg length analysis. So I can look straight down the heels. Right, next part of that, and if I could get you to zoom in just on this part of the table here. We've got a pelvic crank. The pelvic crank is just as it's described. It allows for the pelvic section to angle up and takes a little bit of pressure off the hips and the pelvis. This can be utilized in 2 ways. Firstly, if somebody, for a pregnant or expecting patient, we can take the pressure more on the hips so that they might be able to be adjusted lying on their tummy further into their pregnancy without separating the sections. And secondly, if we've got a heavy patient and we need to take some of the load off the lumbar section, and we can crank this up and then really dial up the tension. Okay, that's the first thing. That's the pelvic crank. The second part is, this is our tensioner for the pelvic section. Right to tighten, left to loosen. So righty-tighty, lefty-loosey. Often the most underutilized and poorly executed adjustments on the table is with this knob here. This is for our directional drop, okay? The directional drop can be changed when we either got the LP section or the P selector drops chosen. Now, we do not crank on that. It does not work that way. You will break it. Instead, we activate the table and it moves. And then we release it and it should stay in place. This control knob shows the direction of the drop. So in this case, the direction of the drop is superiorly from the headward end down towards the feet. So it'll drop down the line of the drop. Second part of that is if we wanted to go a straight drop, again, we hold the switch down. We can move it here. You'll feel it fall into a bit of a groove there. And now the drop is going to be straight down. Finally, we can go inferior to superior. And that means we can put our, for example, a PI adjustment. We can adjust in through this way. And we're adjusting with a bit of an I to S component. Easy stuff. When we're sitting the pelvic drop, what we generally do is, so there we go, set the drop, and then you'll loosen it up, and then just weigh it. And so it should be nearly a full turn past where it drops away underneath the pelvis without any extra pressure. Easy set up there. Next knob is this one. This is our drop selector. The drop selector works as such. The dorsal drop works both the FM headpiece and the dorsal section, which is the thoracic section. Dorsal lumbar means we've got the cervical piece, the dorsal piece, and the lumbar piece. Lumbar pelvic, pretty clear, lumbar and the pelvic section, then the pelvic only. Okay, so just down through here. Important to note, on D for dorsal, you will have the cervical piece, which is the FM headpiece, and the dorsal section moving as one. They can't be turned, the thoracic section will always activate when the dorsal drop is on. You can, however, just use the thoracic drop, and you can turn with this little knob here, you can turn the FM headpiece off, just like that. Now, the timing of an adjustment. I'll just show you how this one is often done. What I see far too often is you have to give time for a pneumatic or air-operated table to activate and for the drop to catch. This is not good habit. Okay? Give the table time for the drop to activate, because there are mechanisms in here that I know you think you might be being clever on occasion, but if you try to overcome the table's own innate desire to recalibrate itself or to reset itself, it's going to be futile. So just give the table just a second. So it should be like this. So the table will raise up and it'll lower just slightly as the drop catches. The other part of that is if you drop into a piston as it's coming up, you will fracture the screws. That stuff is not covered by warranty, and I know the boss doesn't want to pay for stuff to get fixed where it didn't need to be broken in the first instance. This knob here is the tension knob. So if we've got, let's just say, a dorsal and a lumbar drop set, it's going to lift up the dorsal section and the lumbar section. We increase the drop tension by rotating the white dot towards the drop section that we want to increase the tension of. In this case, we've increased the tension on the lumbar section, decreased the drop tension on the dorsal section. As we move it the other way around, increase the drop tension. Now, some people ask me, how do we get both of those drop tensions up together? Well, you can put it in the middle, get the balancing act, and then you take more weight off the lumbar section by cranking up the pelvic section. That's just how that works. That way we can really get all the drops, although I see no need ever to have the lumbar, pelvic and the dorsal drops all going at once. But that's how it goes. Okay, so we can come in there. Good. And through the thoracics, you're working the plane line of the facets. Just jumping up to this way, please, Lex. Last part of this is the FM headpiece. Now, FM means it's forward motion when it falls. So it's not just a straight down drop. It falls from inferior to superior. Okay, so that's great for an FM headpiece, but it's also great for any kind of cervical adjustment where we're using the drop mechanism. So the table will lift up. We can contact the occiput like you would have learnt at the Thompson seminar, or you could do a laminar contact or a spinous knife edge contact. Doesn't matter what it is, but when the table translates forward, it opens up the facets into the spine like this. Okay. And again, we're waiting for that drop mechanism to engage. Once you get good at it, you'll hear the drop mechanism load up, and from there you can get into the adjustment process. But just give it that little bit of a time for the drop to settle so that you actually get a nice positive change when you're doing the adjustment. Good job. So that's pretty much how we use the mechanism of the drop table. Don't force anything. Nothing needs forcing, especially this knob. Okay? It's there to make your life easy. It's there to make the patient's life more comfortable. So anyway, I hope that's going to be some pointer as to how to use the drop table for the guys up at Healing Wave.